Positively Jack's doctoral students at the University of North Florida are once again doing good. They returned to Ghana, where they provide training and clinical support to nutrition professionals across the country. It's really a Positively Jack's movement that has gone to another continent. Joining us this morning to talk about their latest trip and the extensive work that goes into their mission, Dr. Lori Wright with the Department of Nutrition and Dietetics at UNF. Good morning to you, Doc.
Good morning.
So we know the problems in Africa, specifically Ghana. They have been plagued with hunger, with malnutrition, with so many issues related to that. Tell me about UNF being able to help out from literally another continent.
You know, that's one thing that I just love about UNF is the community engagement. We make sure that our students and faculty are engaged in the community. And this is an example of not only just community, but engagement in the global community to do help for the people in need. And also, when we engage our students in the community, the classroom really comes to life. So what they've learned, they can apply it and really see that the good that they can do.
So they chose Ghana. Obviously, there's a lot of need there. Tell me about this mission. How did it work, especially in times of the pandemic?
Well, we have had a 5-year history of going to Ghana. We go to the capital, Accra, and we partner with faculty at University of Ghana to provide training to their nutrition professionals on cutting edge topics within dietetics practice. And then we work with the nutrition professionals to apply that knowledge in the hospitals and in the clinic. All of our doctoral students are dietitians, and so they're able to assist those nutrition professionals in providing that level of care. And we work in hospitals such as the Malnutrition Center for Western Africa. That is an amazing experience treating infants and children with severe acute malnutrition.
And what comes to mind for me, Doc, is it goes back to that, give someone a fish, you can feed them for a day, teach them to fish, and you can feed them for a lifetime. So it's about just equipping them with that education to help thousands in their community.
And in returning to Ghana several times, I see that. I worked with these nutrition professionals multiple times, and I see that they are still applying what we taught them years ago. And that's especially rewarding to know that your work is carrying on through those professionals.
So would you say that things are getting better?
It's very interesting. Malnutrition continues to be an issue, but as that country begins to develop, they change their dietary patterns, their activity patterns, and are beginning to have a lot of difficulty with issues that we have here today: diabetes, hypertension. So the scope of what a dietitian needs to do is actually increasing because of the changes in diseases.
Mm-hmm, mm-hmm. And certainly there's other factors going on. The pandemic is a big issue there. You've got, socioeconomic problems, you've got political problems. So really just a myriad of issues. Tell me about the feedback that you've gotten from your students, being able to get out there and actually make a difference for people who otherwise wouldn't have that help.
Consistently, the students say how their lives have been transformed, how their practice has been transformed. It's such a challenge to work with these patients that don't have the resources. Here in our country, when you come in to a hospital, you're fed by the hospital. There, your family has to provide the food or the specialized nutrition. So as a dietitian, you have to really challenge your thinking of how are you going to get that nutrition to them when perhaps the family doesn't have the means to provide it.
All right. Dr. Wright, thank you, and certainly give all of your students, all of the participants my best, because we appreciate what they do for people who obviously appreciate it as well.